Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking, they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m., this is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Can we kick off? Good morning. I don't think I need introducing, but for those who have never seen me, my name is Mr. Mohammed Kamara. I am a regular here, and I am an A&E consultant. We don't like calling it A&E anymore. We call it emergency medicine. So emergency medicine consultant, and I work here in Greater Manchester. I'm also one of the directors of Khan, and you would have seen me. I think somebody reminded me that I have actually taken part or maybe presented over 35 times. Maybe something to be proud of, or maybe, but anyway, yeah, it just shows that we all have to do our best to give back to society. We need to be in the forefront of making things happen. We obviously are ones that are facing the health inequalities, and so therefore we need to be, driving this sensitivity awareness in order to make sure people know that they have a place, they have a safe place, they have a safe space to talk and get things going. Today, I think we need to talk about a very important topic, a topic that is very close to my heart, because I've got people who suffer with diabetes. Diabetes, as you all may be aware, I don't want to be teaching my grandmas or granddads how to suck eggs, but it's one of those that we call non-communicable diseases, NCDs. Another one of them is hypertension, and obviously in children, asthma. A lot of people don't know that. If you look at the stats, they're startling. I can tell you that. When you talk about hypertension, you have over 14 million people in the UK who have not been diagnosed, but are walking around with hypertension. Now, if you look at diabetes, I think every 2 individuals you meet, there may be a 50% chance of them being diabetic without knowing about it. Now, it's important to know this because I, in A&E, am very concerned, because most of the time, the very first time people find out that they have got hypertension or diabetes is when they end up in A&E or ED with a heart attack, a stroke, kidney problems, and the likes of it, etc., etc. The sort of line continues, if you like. So I wouldn't hold you because we have a very important session today, and we have no less a person than Dr. Joan St. I think she'll tell you a bit about herself, because if I do it, I wouldn't do her any justice. So I'll hand you over to her without any further ado, and she will tell you a bit more about herself. But I'm sure you will enjoy this. Thank you so much. Over to you, Dr. Joan.
Thank you so much. I'm going to call you Mr. Kamara. Or shall I call you Mr. Doctor Kamara?
Yeah, whichever. I'm happy with you.
Thank you for the welcome. Thank you for the introduction as well, setting the scene for this really important topic. It's a pleasure and a privilege to be with you for the Health Hour. This year, I've done it before, not as many as 35. I bow to your number there. Not as many as that, but I have done it before. So we're going to talk about the diabetes digits today, the figures, what matters if you're living with diabetes or if you're at risk of developing diabetes. A little bit about myself. My name is Dr. Joan St. John. I'm a doctor with specialist interests in diabetes and worked in diabetes for quite some time now. So I could talk the whole day about diabetes, but I don't intend to do that. It's a health hour. So we're going to use this hour productively. And together, I hope that we will learn more about diabetes and those figures that really matter. So bear with me 1 second while I try and share my slides. Okay. Dr. Kamara, is that okay?
Yes, it is. Absolutely.
Yeah, you can see it okay. All right.
I can,
So
yeah.
we're going to talk about diabetes digits. What do those numbers mean? As I said, I'm a doctor with special interests in diabetes. I've co-authored a book about foods, traditional foods for so-called marginalized communities, called World Foods. I am a voluntary clinical advisor to Diabetes Africa. I'm a Diabetes UK clinical champion. And as I say, I could easily talk about diabetes the whole day, but we won't be doing that today. So we are going to just bear with me. Let me get the slides working. Let's see what we can do. I'm also, you may have heard of Nana. But it's about diabetes today. So, right, I wanted to start at the very beginning. I want to go back. What's the first figure we're going to talk about? 3,000 years ago, this papyrus denotes the first indication, the first um, recording of diabetes. And I want to highlight where this happened. This happened on the continent of Africa. And I think it's important that we put things in context and put things in place. 3,000 years ago, on the continent of Africa, we were the first to record this condition known as diabetes. It was noticed that ants were very attracted to the urine of people who were experiencing this condition. And this is the recording of that. So I always like to start from a historical perspective because I think it's really important to know your history, and we should be well aware of our history and how important we are within this. So we're also going to talk about things like blood glucose readings, the different ways you can look at the blood glucose, the importance of something called the HbA1c, because I know this can cause a bit of confusion with people at times, the waist circumference and body mass index and measurements and why they might be important, blood pressure management in diabetes, but in other conditions slightly as well. And something which may be a little bit unusual, I want to talk about the urine. I want to talk about your urine today and knowing what your numbers are and health for all. Bear with me 1 second because I need to just close this door. So sorry. Apologies. Okay, so what happens with diabetes? We eat or drink food or drink, and our glucose or sugar, as some people call it, but I like to call it glucose. And I think we should stick with glucose as much as we can today. Your glucose rises in your blood. What happens is, alongside that, your pancreas, which is an organ in your body, releases insulin in response to this rise in glucose. And what it does, it like opens the lock in the cells, in the organs, to let the glucose go into the cells, into the organs, to provide the energy that the organs and the cells need to help our body work. Particularly, it goes up into the brain as well. So to give us the energy so we can think and we can do what we need to do. So that glucose is taken up by the cells, up by the organs, and then we end up with a certain level of glucose in our blood. Now, if you're not living with diabetes, that level is going to be somewhere between 4 and 6 millimoles per litre if you're not living with diabetes. So that's one of another figures that I'd like to point out. Keep that in mind, because I think it's important to know what inverted commas normal looks like if you're not living with diabetes, whether you eat big plate of rice, whether you eat your, Dr. Kamara, what would you like to eat? What have you had this morning?
Interesting you say that. I'm preparing for Ramadan, so I've not had anything.
Okay, so you're in preparation for Ramadan. So
Yes.
and last night?
Last night I had some stew and rice.
Okay, familiar. And if we eat our stew and rice and we're not living with diabetes, we could eat 2 plates of it. Not advocating that, but our blood glucose would still remain between 4 and 6 millimoles per litre, because our fantastic bodies, when they're working the way they need to, match the insulin with the glucose so that our blood glucose level is always within this tight level of 4 to 6 millimoles per mole. So what happens when you have diabetes? Dr. Kamara was saying earlier on about non-communicable diseases and long-term conditions. Diabetes is one of these long-term conditions. Essentially, what's happening is that blood glucose levels is rising, it's too high, and it's essentially caused by a problem with insulin. So we're just doing a little bit of a recap because, I mean, if we're going to talk about figures, we need to know what diabetes is. We need to know what inverted commas normal is so that we can see if things are as they should be or if they require some work or some effort. So remember, it's a long-term condition. It's caused by a problem with insulin. We have 2 main types. So some more figures here, type 1 and type 2. These are the 2 main types. They're not the only types. Let's look at the underlying reason why you might get either of these 2 types. In type 1 diabetes, it's essentially a destruction of the insulin-producing cells in the pancreas. These are called beta cells in the pancreas. And it's a destruction of those cells that leads to the raised blood glucose levels, because the pancreas can't produce insulin. So the blood glucose levels, instead of being helped by the insulin into the cells, into the organ as they should be, it stays in the blood and the blood glucose levels rise. Is what we call an autoimmune process. So your immune cells within your own body go a bit rogue and they don't recognize those beta cells in the pancreas as being part of your own body, and they start to destroy them. So it's an autoimmune condition and it's called type 1 diabetes. Contrast to that, type 2 diabetes. Again, an underlying issue with the insulin, but this time it might be that the insulin is not working properly or not enough insulin is produced. So those are the 2 main types. Type 2 would probably be about 95% of the total population of people living with diabetes. Type 1 would be somewhere around 5%. It does vary depending on which community you're talking about, but those are the sort of overall figures. Just want to say a little bit more about type 1 diabetes and focus on that a bit more before we move on to talk about type 2, because type 2 is the majority of people living with diabetes, both nationally, internationally. So, but let's spend a little bit of type 1, a little bit of time on talking about type 1 diabetes. Now, I think it's really, really important that you pay attention to these 4 T's. The 4 T's will help you to recognize perhaps the signs of somebody developing type 1 diabetes. Type 1 diabetes used to be thought of as a condition of childhood and young people, but we know now that isn't the case. It can occur at any age, at any stage of your life, although there tend to be peaks, and those peaks can be within childhood and for young people. What are those four T's? So if you notice that the child or the young person is going to the toilet more frequently, they might be getting up at night to go to the toilet. If they're young enough and they're wearing nappies, the nappies might be getting more wet, or they might be soaking through the nappies. That might be the way that you discover this. They might be more thirsty, so needing to drink more, and again, getting up at night to drink. It's very unusual for children or young people to feel tired. I mean, if they're running around and you can see a recognizable cause, then you expect a certain amount of tiredness, but that undue tiredness is a red flag, is something to watch out for. And certainly we don't expect children or young people to be losing weight. So those four T's are really important because I, I'm not sure whether I should call you Doctor or Mr. Kamara. I'm going to call you Dr. Kamara. Okay.
Fine.
Okay. Dr. Kamara works in A&E. He works in ED. Now, he would unfortunately, I'm sure, see some children or young people coming through A&E, ED, when these signs haven't been recognized and actually they end up in a life-threatening scenario. It's something called diabetic ketoacidosis. It is life-threatening. It is vitally important that we don't allow children or young people to get to this life-threatening stage, this really serious stage. But because if we recognize these signs and symptoms first, and then we seek medical help. And the other thing I'm going to say to you is don't be palmed off. If you are noticing these changes, if you are concerned about your child or young person, then please insist that things like a blood glucose is checked because it's vitally important. We don't want children to end up in that emergency situation. So, what are the hopeful things? Or let's do a bit of myth busting and then we'll talk about some hopeful things around type 1 diabetes. As I said earlier, it can occur at any age. We used to think it was just children and young people. That is not the case now. We recognize that it can occur at any age, any stage of your life. Insulin is a necessary treatment because, as I've said, if those beta cells, those insulin producing cells in your pancreas are destroyed by your immune system, that auto antibody process, then you need insulin to treat this type of diabetes. At this time in our lives, we definitely need insulin. Maybe in the future, and I'll show you what might be on the horizon, things may change, but at the moment, insulin is an absolutely necessary treatment for type 1 diabetes, no question. It's not associated with lifestyle. And I think it's important because, when children are catapulted into ED, A&E in this life-threatening situation, can you imagine how the parents and the guardians feel? They're searching for answers. Why did this happen? What was the process? Was it something that we did or didn't do? It's not associated with lifestyle. It's an autoimmune condition, which we're learning more about. And I think this is one of the hopeful things that we need to look forward to. And just to point out that some people get a bit confused because if you're living with type 2 diabetes and you start treatment with insulin as well as other treatments, it doesn't mean that you've now developed type 1 diabetes. It is still type 2 diabetes, but it is just treated with insulin. So just to clear up that myth. So what's on the horizon? What's hopeful? I think research is making great progress with people living with type 1 diabetes. Screening, there was recently a result of a scientific study, the ELSA study, showing that actually we will be able to screen people for type 1 diabetes. What advantage does that offer? Well, it would enable people to realize that they are at risk of developing something. And we always say, it's better to be prepared than just to be thrown in at the deep end. So screening will afford people the opportunity to have planned care, planned knowledge, planned information, and that it not to be this sort of crisis situation and then having to deal with it. I've explained to you it's an autoimmune condition. And again, on the horizon are some new immunotherapy regimes where you would be able to treat those rogue parts of your immune system which are attacking the beta cells in the pancreas and stopping your body producing insulin. Beta cell replacement is possible at the moment, but it's quite an involved and difficult operation and requires people's immune system to be dampened down so that they don't react to the external beta cells that are put in them. But in the future, it may be possible to regenerate your beta cells or to generate new beta cells from what we call stem cells so that you could start producing your own insulin again. And then there may be new ways to protect and support transplanted beta cells. So I think there are hopeful things on the horizon for people who are living with type 1 diabetes. What I'm going to do now is talk more about type 2 diabetes because, as I said, this represents the vast majority of people who will be living with this condition. And so I think it's important that we focus on this. The underlying process here is that the insulin isn't working properly or less insulin is produced. It's not about autoimmunity. So to clarify, when we're talking about digits and what we can do and what we can learn, we're going to deal with these things. So we're going to look at blood glucose readings, something called the HbA1c. What does that mean? Waist circumference and body mass index, your blood pressure, and your urine. And I keep stressing this because maybe it's something that, we don't talk about, but I want to say to you this morning, it is vitally important. It's vitally important for your health. It's vitally important for your healthcare professional that they are able to test that. But, more about that later. So, blood glucose readings, the different types, because I think this can cause some confusion. So I think let's clarify this and then we can talk about the various figures associated with it. Now, it's a bit like you say plantain and I say plantain, right? You say tomato and I say tomato. It's just a different way of looking at what your blood glucose reading is. If you do a finger prick test, the top right-hand corner there on my screen, it will give you a snapshot from the capillary, the tiny blood vessel at your finger, what your blood glucose reading is now. So it's like a snapshot. It's like you take a photograph. At this point, if you do your blood glucose, it's 6 or 7 millimoles per liter. Okay. In the middle, the lady has a white disc on her arm. This is a different way of looking at your blood glucose reading. It actually measures your blood glucose from a different part of your body. And so it gives a slightly different reading, but it is still looking at your blood glucose. And down at the bottom, there's the young man who is so happy to get an appointment with his GP surgery to get his blood test. He's actually smiling and having his blood test done. And that gives us a different indication of what your blood glucose is. And that's the one that we call the HbA1c. So we can get an idea from these different aspects, these different perspectives of looking at blood glucose, what your blood glucose is. I want to stress that for each individual, if you're living with diabetes, whether that's type 1, type 2, or one of the other types of diabetes, you have to discuss with your individual healthcare professional what healthy is going to look like for you, because healthy for you may not be the same as healthy for your sister or your auntie or, one of your friends. It's not going to be exactly the same. You are an individual, a beautiful individual. And so we as healthcare professionals do what we call person-centered care. For you as an individual, what is healthy going to be? And you should know what your blood glucose should be, what your HbA1c should be, as we go on further, what your blood pressure should be, all of those things. Why is it important? We'll talk about that in a few minutes. So let's talk a little bit more about the continuous glucose monitoring, which is the disc that you can see on the arm, which you may have seen advertised on the television. People can see what their blood glucose is from their telephone or from the mobile phone or from a sensor. The little needle from this disc goes into your skin on the arm usually, and it senses the glucose in something called the interstitial fluid. Don't get too hung up about that. That's okay. All I'm saying is that when you do the finger prick test, it's coming from your capillary. When you do this continuous glucose monitoring, it's coming from the interstitial fluid. And that's why it's a little bit different, the readings that you might get. But what I have to point out to you is this continuous glucose monitoring is continuous glucose monitoring 24/7. You can get your glucose monitored, you can get your glucose figure or range from first thing in the morning, last thing at night, in the middle of the day, minute by minute, hour by hour. You can see what's happening. Is it trending up? Is it trending down? Is it where it should be? It has revolutionized blood glucose monitoring for so many people, particularly people who are living with type 1 diabetes who had to prick their finger 8, maybe more times a day. This enables them to monitor their blood glucose, as I say, 24/7. It has been a revolution, and it has been wonderful for the people who are lucky enough to have that. So I want to clarify what HbA1c is, because this causes a lot of confusion. Your blood cells go around your blood vessels. They last for 2 to 3 months. This really smart test called the HbA1c will check how much glucose has stuck to your red blood cells over that 2 to 3 months. And our bodies are continuously making new blood cells, but we can sense from that blood test how much glucose has stuck to your blood cells. And that's what gives us the figure called the HbA1c. So on the right, you can see if you don't have a lot of glucose circulating in your bloodstream, your HbA1c is going to be low. But if you have a lot of glucose circulating in your bloodstream, your HbA1c is going to be high. Now, remember, it's just a different way of looking at the blood glucose. The finger prick test is like the snapshot, like you're taking a photograph. The HbA1c is more like the video that was looking back over 2 to 3 months and giving us a broader picture, a sort of average of what has been happening. Let me demonstrate to you some figures here. So if you are talking about HbA1c, okay, remember that's looking at your sort of average glucose over the previous 2 to 3 months. What's normal? What's amber? What's putting you at risk? And what is diabetes? Because we use this HbA1c to make the diagnosis of diabetes. So here are some more figures for you. Normal, if you have an HbA1c, and an HbA1c is, remember the gentleman sat with a smile on his face having his blood test done. This is the one that you're going to have when you go to your GP surgery or your clinic. Normal is less than 42 millimoles per mole. We used to describe this as a percentage, but for decades now, it's been millimoles per mole. Let's stick with that. Pre-diabetes, borderline, at risk. The proper name for it is non-diabetic hyperglycemia, but that's a big mouthful. So when they say to you, it's borderline, what are they talking about? You've had a blood test and they're saying your HbA1c is somewhere between 42 and 47. Why does it matter? Remember what I said to you about the screening with people who might be at risk of developing type 1 diabetes? If you have a blood test and somebody tells you you're at risk of developing type 2 diabetes, you can do something about it. I mean, we can talk more about what you can do about it, but at least you know that you're at risk. If you don't know, how are you going to do something about it? And if that figure is 48 or more, then we would normally make the diagnosis of diabetes if you have the symptoms of tiredness, thirst, passing urine a lot, rashes, infections, things like that. One reading and the symptoms would give us the diagnosis. But if you don't have any symptoms, you must have that blood test checked again. Okay, so these things are important because we have to take responsibility for our own health. We can't rely only on healthcare professionals taking responsibility because we want agency in what is done. And the only way to do that is to be informed about what is normal, what isn't normal, what needs checking again, so that you can do something about it. Now, it's a bit of a busy slide, but what I wanted to show on this is the variety of ways that I've described that we can look at the blood glucose. So on the top, we've got those figures of the HbA1c, and it's in green, amber, and we're going to red. Now, you as an individual, your green may be different to this green, but I've put it up as a general slide just to show you how those figures from one way of looking at your blood glucose equate to figures from another way. So if, let's say, for example, your HbA1c was 42, right at the top left-hand corner on my slide, if you look down, likelihood is your average blood glucose, like the capillary one, the finger prick one, is going to be somewhere around 7. So it's pretty much within a normal range, just about. Yep. And that disc that you wear on your arm for continuous glucose monitoring would show that something called time in range, the time in the range of what we would consider normal if you're wearing one of those discs, is about 80% of the time you're going to be in that normal, so-called normal range. So it's just how, looking at it from different perspective can give us the different figures. I want to highlight some wonderful work that has been done by the Black Health Legacy. Because remember, I said to you, HbA1c is the way we use to diagnose people who were living with type 2 diabetes. But the study by the Black Health Legacy found that 1 in 7 males of Black ethnicity carry a particular gene variant, which means that they are deficient in an enzyme called glucose 6-phosphate dehydrogenase deficiency, a big mouthful. But what does it mean? It means that actually, remember, I spoke to you about how sometimes the immune system can go rogue and cause type 1 diabetes because it attacks those beta cells. Well, if you have glucose 6-phosphate dehydrogenase deficiency, in certain circumstances, in certain environments, it can attack or destroy your red blood cells. Now, if it's destroying your red blood cells, and we are looking at your red blood cells and how much glucose is stuck to your red blood cells to tell us your HbA1c, you can see how they were able to generate this fantastically useful information for us that Black and Asian people, men usually, who have this glucose 6-phosphate dehydrogenase deficiency gene, have a lower HbA1c for the same blood glucose level. The implications of that are that carriers of this gene may have a 4-year delay in the development of their diagnosis of type 2 diabetes. And that, unfortunately, could put them at greater risk of what we call microvascular small vessel complications. So it is hugely important to know if you're at risk of this, if we're making the diagnosis, and how would you know that? Well, one of the things that might happen if you're living with type 2 diabetes and you're doing the finger prick tests, so the glucometer, and your blood glucose readings don't coincide or don't match what we would expect in your HbA1c, that may be a pointer to say you may be at risk of having this glucose 6-phosphate dehydrogenase deficiency gene. So I think it's great work that the Black Health Legacy have done, and we know that there's going to be more great work to come from the studies that they are doing. But just wanted to flag that up because I think it's really important for us to be aware of. So 1 in 7 Black men are going to carry this genetic change, and that will affect perhaps the diagnosis of type 2 diabetes and could put them at increased risk of complications. What are those complications? Why is the blood glucose important? Because with this chronic condition, if the blood glucose is not as close to a normal level as possible for that individual, it puts you at risk of developing complications. It's like it opens the door to that possibility. And what we want to do is not open the door to the possibility of all of these complications, things like heart attacks, strokes, kidney conditions, heart problems, skin infections, feet problems. We want to prevent it. Prevention is always better than trying to cure. And sometimes it's not possible to cure some of these complications. So blood glucose is important. Yep. Sometimes people will come to me and will talk about their results, but the implications of whether it's high doesn't necessarily fall into their understanding. And I think it's so important that we are aware and knowledgeable about what is normal for us. So what does healthy look like? Okay, I'm aware that of time. So let's talk about waist circumference and body mass index. Now, I think most people would probably put the body mass index before the waist circumference in terms of if you go to your clinic, your GP, your health provider, most people are going to do body mass index. And I'm sure if I did a straw poll today, few of us have had our waist measured. But actually, I think we're coming to the conclusion that waist circumference is more important in terms of recognizing cardiovascular risk. So that's just the circulatory risks than body mass index. So you can see from the photos, we've got somebody in the red and somebody in the green. And what does healthy look like? Healthy, obviously, we're using traffic light system. The green, the lower the waist circumference, the healthier it's likely to be. So different ways of looking at the waist circumference. Easiest thing you could do, you can do it today. You can make a difference to your health. Oh, sorry. You can make a difference to your health. You can find out what your waist circumference is. And this is not the same as your jeans waist size. I just want to I want to point that out because people will tell me, well, I used to wear so and so waist jeans. And you can squeeze sometimes those jeans on, but that does not equate to your waist circumference. Your waist circumference you measure if you can feel the bottom of your ribs. Do it now, bottom of your ribs. Dr. Kamara, I can't see you doing it.
Yes, you
Where's your
understand?
come on? No, you don't have to stand up, but where's the bottom of your ribs? Got it?
Yes,
And
yes,
the
I got it.
top of your hip
Yeah,
bone, got it?
yeah,
Yeah.
yeah,
And if you
yeah.
guys, if you can't feel it, then there's definitely work to be done. Okay, we've got the bottom of our ribs, we've got the top of our hips, midway, middle of that, we get a tape measure and we measure. And if you're depending on what gender you are, you can see here what the figures are. So for a woman, less than 31, I'm using old money, I'm not in the centimeters yet, less than 31.5 inches is healthy. But if you're going above that, then it's putting you at risk. Why do we say that? If you've got fat, okay, if you've got excess around the waist, if you're carrying it around the waist, it's like a signal for what's going on underneath the skin, what we can't see, that it's likely that you're putting fat in those organs around in your abdomen. And those organs, the liver, the pancreas, if we're talking about things like diabetes, they're really important because if fat gets in there, it means that they're not going to work as properly as they should do. And that is going to increase our risk of developing things like diabetes or heart disease. Now, okay, you don't have a tape measure. What else could you do? You can still do something. It's dead easy. You can either know, if you know your height, not a problem. You can take a piece of string, all right? So you don't even have to have a tape measure. Take a piece of string, put it top of your head, let it fall down to the floor. Cut it. Put it in half, put that round your waist. That should be going round your waist. And if that's not able to go around your waist, then again, there's work to be done because then you're in this, you can see on the left-hand side, the 0.5 to 0.59 ratio or 0.6 plus is putting you at risk because you're carrying too much fat, likely under the skin around those organs. So your waist should be half of your height. And I always say this, it's not half of your height when you're wearing heels. It's half of your height when you stood on the floor. Talk about body mass index. I always like to show this slide because I think it was really useful information to tell us what's important. So here is another figure for you. Depending on which community you belong to. I'm from the Black community. So for me, healthy, if you follow that blue line down, is less than 28 kilograms per meter squared. The body mass index is your weight over your height, and it gives us a figure. So for us, sorry, I speak for myself. For me, from the Black community, healthy is below that 28 kilograms per meter squared. If I'm going above that figure, I'm putting myself at risk of developing not only type 2 diabetes, but other types of cardiovascular conditions. Move on to speak about blood pressure. So blood pressure is vitally important. I have to say that if it's high, it puts you at risk of things like stroke, heart attack, and something called heart failure, which people sometimes forget to mention, but is another chronic condition which can make life very difficult. So again, if it can be prevented, then it's best to do that. Now, in the UK, NICE says they've sort of changed things, the way they approach it. Now they've got a bit of almost like a one size fits all in that everybody's blood pressure, they say, should be below 140 over 90. So when you are in a clinic, GP setting, pharmacy, and you have your blood pressure checked, should be below 140 over 90. When you're at home, tend to be a bit more relaxed. So they say it should be below 135 over 85. So make a note of these figures. But I want to say something a little bit controversial here because these figures vary depending on whether you're in the US or whether you're in the EU. And my feeling is that it's all well and good to get everybody's blood pressure below 140 over 90, but I think we do have to be a bit more targeted in our approach. And I think that for some people who have an increased risk of what we call cardiovascular conditions, so those circulatory conditions like heart attacks and strokes, that the lower, the better. Obviously not too low, but certainly lower than 140 over 90. Now, some people would say 130 over 80 if you're living with things like kidney conditions, if you're living with certain types of diabetes or you've been having it for a certain length of time, if you have heart conditions. And my feeling is that we really need to be targeted. We are beautiful beings, each individual we are, and we need to speak to our healthcare provider and see what is going to be safe for us in the context of what other conditions we might have. Now, if you are frail, it says over 80, But I know a lot of healthy, robust 80-year-olds. So I'm not talking about age, I'm talking about frailty here. If you are frail, then yes, 140 over 90 is going to be appropriate for you. But sometimes it is the case that, as I say, if you don't have frailty, then lower will be better. I have put a link there because I think it's a good idea for us to know what our blood pressure is, and we can monitor that at home. The machines cost somewhere around 20, £30. What's that? About 5 or 6 cups of coffee or something. So it depends whether you decide you're going to, Lent is coming up, Ramadan is coming up. It depends whether you're going to invest. Dr. Kamara had a wonderful, and he'll tell us the saying later, your health is your wealth. Yeah. Are you going to invest in your health? Are you going to buy a blood pressure machine and monitor your own blood pressure? Or are you going to rely on just going to the GP surgery? If you can afford it, it is a good investment. Okay, urine. Now, it is so important. I can't stress this enough. If you're living with diabetes, every year you should get what we call the 9 key care processes, one of which is testing your urine. And this is the one that we as healthcare professionals have the most difficulty getting. I know, it can get a bit messy, it can be a bit difficult to do, where are you going to do it, how are you going to do it? But trust me, it is so important. Your kidneys act like a filter. They will keep the nutrients in, they will keep the protein in that we need, but they will let little bits come out into the urine that we don't need. Now, we are finding tiny proteins in the urine. That is a warning sign that the kidneys are not working as well as they should do. Imagine the kidneys like a sieve or like as I said, like a filter, like a colander. And imagine that the holes in that sieve are getting bigger. So they're letting little proteins come through, first of all, which shouldn't be coming through into the urine. We can detect that in the urine, and that signals to us as healthcare professionals things aren't going as well as they should do, and some action needs to be taken here. So it can be a signal of something called chronic kidney disease. Now, I've seen this many times that somebody will go along for an appointment and the healthcare professional will say, "Oh, and your chronic kidney disease." And it's a shock to the person because they never knew that. They never understood that. They were never aware of that. How is that diagnosis made? That diagnosis is made from the blood test added together with the urine sample results. And again, using that traffic light system, that can tell us so much information about whether or not somebody has chronic kidney disease or is at risk of developing it. And if they have chronic kidney disease, this can provide a risk of developing cardiovascular heart disease, actually. So your urine can tell us about your heart health. It sounds strange, but it can. And that's why it's so important to produce that urine sample. If you're living with diabetes, make sure you produce that urine sample every year and make sure it's checked every year. And if the first one is abnormal, they'll ask you to do an early morning sample and you should do a repeat. But if you're ending up with large amounts of protein, that's in that red area there, which is showing that it's more serious and there's a greater risk. So I've sped through some digits. I've sped through blood glucose readings, how we look at them, whether we're saying plantain or we're saying plantain. Yeah. Whether we're saying HbA1c or we're saying um, continuous glucose monitoring, it's just a different way of looking at it. We've looked at waist circumference, what is healthy, how you measure it, how you know what's healthy for you as an individual. Remember, half of your height, so you can drop that string from the top of your head. Your blood pressure and what you can do about that, so to get the machine. Your urine and how important that is. And then let's talk a little bit before we end about health for all. So whether you're living with diabetes, at risk of it, don't have it, don't know about it, what can we do? If you're living with diabetes, if you'd like some more information, we host of a series of webinars called Diabetes Health Matters, produced by Diabetes Africa, which is a wonderful organization trying to eradicate diabetes for people of African Caribbean origin, particularly, but not exclusively. So you can head over to the Diabetes Africa website. On the YouTube channel, there's lots and lots of webinars with different information from fantastic experts. You can have a look at the handbooks, the toolkits, which are available on the Diabetes Africa website, whether we're talking about technology, whether we're talking about foot care in dark skin tones, because we as healthcare professionals, when we were doing our training, for the vast majority of us, all that we were trained on was white skin. We were never trained, very, very rarely, Dr. Kamara, I don't know if that was the case for you, on dark skin. And recognizing signs and symptoms of when things aren't going as they should do in foot care, if you're living with diabetes, is vitally important, because it may mean the difference between somebody developing an ulcer, somebody having even more serious complication developing. And we've had nearly 50,000 downloads. These are free as well, I should tell you. These are free to download. If you want to know more about type 1 diabetes, but maybe you want to know more about type 4, type 5, and the different types. Again, the Diabetes Health Matters series, Dr. Jean-Claude Catte did a fantastic series for us recently on all the different types of diabetes. Advancing equity, because it is vitally important to us that we try and address health inequalities, particularly within the context of diabetes. So there's another toolkit and handbook available for policymakers, scientists, people who live with the condition. Some more resources. Diabetes UK have some, on their learning zone, have a few, can't think of the word, few videos. And also I've just put in the book as well that I co-authored. So make sure you move, do something. We've sat here for nearly 50 minutes. We should have moved. We should have lifted our arms. We should have stood up. Well, Dr. Kamara did stand up at one point. We should be doing something. Yeah. We need to stop lying down and just watching EastEnders or Corrie or whatever it is. Get up and move and do something. Put on some music that you like. Do some lifting some heavy bags, it says on here. Do some yoga or some gym walk, connect. And what other things could you do? If you want to know what your figures are at your GP surgery, at the pharmacy, on your GP record, the NHS app is actually quite helpful. I can see what my latest HbA1c was. I can know when that was done. So some of you might be inclined to consider actually downloading the NHS app. You can use it for your own health. But don't forget, eat well. Lots and lots of vegetables. Eat a rainbow if you can every day. Move more. Sleep soundly. Definitely don't smoke. Stay connected. It's so important for us, isn't it? Socialization is so important. Drink a lot of water, which I haven't done. I'm going to do that when I finish. And be aware and check your health status. So think about what figures that I've highlighted to you today matter most to you. What are you going to aim to change? Is it going to be your waist? Is it going to be the water? As I said, I'm going to be doing that now. I've been for a walk already this morning. So you decide. What are you going to aim to change? Remember, we've got Lent coming, we've got Ramadan coming. There is another opportunity where at the last day of January, it's still not too late to do your New Year's resolution. So yeah, come on, let's do something. And each one teach one. If you've learned something new, please go and share that with somebody else, with your community, with your church, with your mosque, with your temple. Share it so that we can all learn more. I love the wonderful Dr. Maya Angelou, and I think it's just such wise words because we do the best we can until you know better. I hope you might have learnt something today so you will know better. And then when you know better, do better. So thank you very much.
Wow. Dr. St. John, well, you are my hero. Wow. I
Thank
don't
you.
think I don't think I've ever been blown away like you have. I thought I knew it all, but I tell you what, I've learned a few things myself. I don't
Oh my
know.
goodness. Oh, thank you. That
Amazing.
you are esteemed, and I thank you so much for that. Thank you.
It's amazing. I think the audience will echo. In fact, a testimony to the talk, onto the very last minute, somebody is entering the room as well. It just goes to show. I have never heard you speak, but I tell you, I can sit here and listen to you all day.
Thank
I
you
can tell
so
you,
much.
and
Thank
I'm
you.
not patronizing you in any way. I think this is, in fact, if I can make a personal request, I need a copy of these slides, please, because it will teach me and my group. And you mentioned that my group, I'd say my brainchild, Well Body, Better Path Gentry, as we said, it means good health is better than wealth. I mean, you
Yes.
can be rich, filthily rich, as they say, but if you lack health, I tell you what, you are the poorest person. I can tell you that for free.
Mm.
Now, I'm conscious of the time. I think this should be changed to not Kathy hour, changed to Kathy 2 hours, because the pace, the pitch and the level at which you do it is unbelievable. I don't think I've ever listened to anyone in this particular forum that has actually handled it and got a handle of it as you have done, because you've touched everything. And I can
Thank you so
say,
much.
I can't even emphasize what I've learned. Like I say, people don't realize that there are 5 types of diabetes. And you've just mentioned it like
Hmm.
that. A lot of people don't know that the 5th one has just been recently discovered, which is the malnutrition related diabetes
Associated.
mellitus.
Yeah, yeah, yeah.
Many people haven't heard of that. So it just goes
Hmm.
to show you that indeed we need to be in the forefront, like you're doing now, to sensitize, to screen, to sort of like educate our people to what's
Hmm.
this. As you said, the stats are startling. Like the male with like I learned something now, which is the G6PD.
Yeah.
Gene. It was like, ooh, where's that come from? I don't know. But yeah, but that's brilliant. So I don't want to hog the platform. I think there are a few questions that I could see. Yeah, I think somebody mentioned that, what was it now? They said something about, they're just talking about the importance of it. I think you've turned them into something. Right. Now, my doctor says my numbers are borderline. Is
Hmm.
medication necessary yet, or can I reverse this with diet alone?
You can absolutely reverse it with diet, with activity. You can also go to the NHS prevention program if that's something you'd like to do. It is a 9-month program when they will tell you about the food that you're eating, the activity that you're doing, the sleeping, the things that we said about, healthy living, and you absolutely can reverse it. And, I think, again, that's a good news story. Prevention is always better than cure. So if you are able to either prevent or delay going into that red range, if you remember that slide, which I had the green, amber, and red, then yes, it's possible. Very, very possible.
Brilliant. Thank you. I can just echo that sentiment. Definitely. Yeah. If you catch it early on, and I think I'm told if you lose 20 kilos of your original weight, you're very likely to reverse the trend.
And you
Uh,
can
it's
you can lose even less than that. That's the
exactly,
thing, you can lose
exactly.
even less. It's not easy to lose weight. I'm trying to lose weight myself. So, I'm with you. It's not easy to lose weight, but if we persevere, because let's invest in that rather than end up in a situation where we're then talking about medication and different things. But prevention is always better.
Yes. I think the add-on to that is my dad isn't diabetic, but my mom is type 2. Does that make me predisposed?
Yes, there are things that will predispose us, increase our risk. It is not inevitable. That's the other thing to say, but it definitely increases your risk. So, what I would suggest you do, there is an easy way that you can find out what your risk looks like. If you type in Know Your Risk to any web browser, it will come up with a series of questions, usually about 7 questions, which will ask you your ethnicity. It will ask you your blood pressure. It will ask you your weight. It will ask you your height. It will ask you if you're on any medication. It will ask you if you've got any family history. And then it will come up with a low, medium, or high risk. If it's medium or high, you can actually download or print a letter, which it will give you, and you can take that to your GP to go and get that blood test. Remember the guy that was smiling? So you can go and get that blood test and see what your HbA1c is. And remember that slide, which was the green, amber, red. It will show you, are you in the amber? Are you in the green? Are you in the red? Because you might not even know if you're in the red. Yeah. So yes, absolutely. That, your family history, but our ethnicity, so called, puts us at increased risk of developing type 2 diabetes, carrying that excess weight. If you've had diabetes during pregnancy, all of those things can increase your risk of developing it. So, but know your risk because then you can do something about it.
Apologies, I think we have to just a bit over time. As you were, I think this is a
Oh,
very, very
okay.
important topic. And I think people will understand that and probably appreciate that. Now, there's a question about my doctor says my numbers are borderline. No, I think we've done that. They're just coming on thick and fast. Okay, that's it. Are there plans to start microbiome testing on the NHS? I heard that for some, an imbalance can affect HbA1c.
Yeah, I find this fascinating. And I'm a bit weird. When I when I used to go to some of the conferences, and there would be a talk about this, I would go along to it. It is an emerging field. That's all I can say to you. It's not on the NHS yet, but we are getting to know more the microbiome, the millions of bacteria that live within us in our gut and actually keep us healthy can affect things like diabetes, but many other conditions as well. So it's not available on the NHS yet, but one of the things we do know about the microbiome is that you can keep it healthy with certain things and certain things like fiber. So fiber is really important in our diet. So keeping a high fiber intake is really important to keep a healthy microbiome. But no, it's not. Testing of microbiome is not available yet on the NHS. But watch this space. Who knows in the future?
Super, brilliant. Now, I don't even want to use the word, the dreaded Monjaro, right? Is it good for weight loss? That's what they're asking. And I think I know
Ooh,
the answer to that, but people prefer the
okay.
easy way out.
So, okay, I usually when I'm giving a talk, I prefer not to speak about specific medications because it gives the impression that one may be better than another. And I've said that we are all beautiful individual beings. I'm going to talk in general about this class of medication. This class of medication was originally for diabetes. That's the first thing to say. And it was found that when people were being treated with these medications, as a consequence of that, they lost weight. And it has now sort of been flipped to be considered almost like weight loss medication. So I just want to, again, as I said at the beginning, history is important. So yes, they absolutely can help some people to lose weight, undoubtedly. It's not easy to lose weight. As I said, I'm trying to lose it. I know it's not easy. And for some people, this may be a way to enable them to be healthier by losing weight and perhaps if they're living with diabetes, by helping blood glucose levels to be lower as well. For some people, this is going to work well. It is not a cure-all for everybody.
Thank you so much. As I say, I wanted to just highlight the fact that there are, as medics, we prescribe some medications, and what we don't do is sometimes tell our patients the possible side effects. I know it's a conundrum. I mean, you can't actually say, you can say, I robbed Peter to pay Paul. That's what we're doing as it happens, because there are medications we prescribe, for example, for hypertension, and they, in some ways, raise the sugar or the glucose. We stick to it. So this is something people have to be aware of. So if you don't have the symptoms, and yet the readings are such that it's reading high, i.e. the HbA1c, I normally tell my patients, they remember the HSBC as opposed to the HbA1c. So that's how I
Banks
do
are
it.
available.
Yes, that's right. But yeah, so it's just for people to understand that, look, when the readings are high, it doesn't necessarily mean that that's the be all and end all. There's always a way around it. Now, in fact, I have worked with a colleague who is an endocrinologist. He's had somebody live with diabetes for, wait for it, 50 years. 50. And we actually celebrated it in grand style. For someone to live with diabetes, type 1 for that matter, 50 years is unbelievable. And as I said, I've learned something new, whereby type 1 can set in at any age. We all were taught to believe that this is a childhood illness. And of course, we were taught to just look at it from the Caucasian perspective, not with the BME perspective. And it's important to remember that there are differences and we have to be mindful of that. I look at your slide. The last one is my favorite heroine, Maya Angelou, but there's one of the thank you words that just springs to mind, Ngiyabonga. It sounds beautiful. It's so melodic, but there's one that is missing, which is Spasiba. If I tell you I'm half Russian, you won't believe it, but that's it. Thank you so much, and I'll hand you over to Natasha for the closing. But thank you ever so much, Dr. St. John. I thoroughly enjoyed this, and I hope I'll get to speak to you again. Thank you so much.
Thank you. Thank you so much, Dr. Mr. Kamara.
Thank you.
Sorry,
right, over
both.
to you, Natasha. Yeah.
But it will be my colleague Healthy presenting. But meanwhile, I don't know if you'd have a few minutes to answer one of the LinkedIn questions, because in the last 10 minutes, a lot of people put questions on LinkedIn.
All right,
Some of them know Dr. Joan, I believe. So if at least one of them, that would be great.
Well, I think there's the last one I can say. How often should we request a glucose test from the GP? And then how often would you advise individuals to have the HSBC, HbA1c done? Do you suggest intermittent fasting for diabetes? Well, I think the answers are there. Intermittent fasting is absolutely brilliant. In fact, I'm going to be talking in the next 2-3 hours about fasting and your health. So if you want to join us, you are free on your Saturday afternoon, then yes, by all means join us. I'll probably put the link and we'll see how it goes from there. But yeah, I have a whole talk on that, intermittent fasting and fasting on your health. Yeah, it definitely helps that. And I think I'll leave Dr. St. John to probably, I don't want to rain on her parade. And so, yeah.
So quick fire answers. How often should you have your blood glucose tested? It depends. If you're at risk of developing type 2 diabetes, then every 6 months to every year may be appropriate. So if you're in that amber range, if you're living with diabetes, type 2 or type 1, it will depend on where you are for you as your individual target or goal levels. So you would have a certain individualized level that you should be aiming for in discussion with your healthcare professional. And depending, if you're not there yet, it might be every 3 months that you have your blood test. But if you are there and you've remained at that sort of level, it could be every 6 months to every year. But I think really it should be every 6 months. I think a year is a long time to leave it not knowing. Intermittent fasting, absolutely. And yes, it is safe. It works well. There are many different forms of eating that can be helpful if you're living with diabetes. The so-called Mediterranean diet, intermittent fasting, all of those things can be helpful and can be still useful to lower your blood glucose. But it's what works for you. Again, as an individual, you're going to have to decide which one is going to be best for you. So I think that answered those questions, didn't it? Can I just
Indeed, it
say
does.
something very, very quickly? Ramadan is coming up. I hope that you've had some discussion with your healthcare professional, if you're living with diabetes, how to safely fast in Ramadan, because we want to respect and acknowledge that holy month, and we want you to be able to do that safely. So I would hope that your healthcare professional and you have had a discussion about that.
Yeah, to piggyback on that, it should have happened at least a month or two before now. It's absolutely vital because there's four levels. Instead of the green, amber, and red, there is another
Yeah.
one just in
Yeah.
between. I think the University of Leicester developed that, if you like, that chart, and it's important
Yes.
to do that. But in my talk, I'll include that today. And if there's a need for me to do anything here on this platform, I'm more than happy to do that. But thank you so much.
Yeah.
If there's no further questions or no further requests, I think I'll hand you over to, was it Haile or?
Yes.
Yeah, Mibwala.
Yes, thank you very much.
Thank you so much.
Shall I stop sharing?
Yes, please. Thank you so much.
Okay. Thank you
Thank
very
you.
much. Thank
Thank
you.
you.
Really
Thank you.
appreciate it. Thank you.
No, you're a legend, I must admit. Thank you so much.
Thank you so much.
All right. Hello, everyone. Good afternoon now, I guess. My name is Helmi, and I will be doing the closing slides for today. If you just bear with me 1 second, I'm going to share my screen. All right, please let me know if you can see my screen. Yeah?
Yeah.
Okay, great. So I just want to first of all say a very big thank you to Dr. Joan and Dr. Kamara for taking your time to speak to us today. We do really appreciate how much time you've dedicated to CAN and how you supported the advocacy for CAN as well. We really appreciate that. And today's topic was really important because I myself am trying to lose weight. So a lot of things that you said, I've reckoned with. So just to let you know, Health Hour will be back again next week, and we'll be joined by more Black healthcare professionals who will be sharing their expertise. And the topic would be on caring for Black skin and hair, and this would be on the 7th of January, same time, 11 a.m. to 12 p.m. All the registration details are here if you need any help with that. Right. Black Healthcare Awards 2026. The nominations are now open for Black Healthcare Awards. This is essentially about recognizing excellence and innovation and impact in our healthcare system. So if you know anyone who's doing amazing work, or if that's you, please go ahead and nominate yourself. This award will be taking place in London on the 4th of January. Thirdly, we have International Women's Day once again. We are celebrating with a very special focus on womb health in the digital era. And it's free. It's aimed at empowering and informing our community, especially spotlighting, contributions that our women have made in society, and just focusing on women's health. So all the dates for the events, the QR code and contact details on the slide. If you do need any assistance or any more information, please feel free to contact using the email address below, and we will get back to you. NHS Blood and Transplant, we want to highlight the importance of blood donation, especially for our Black communities. It's very important for us as Black people to donate blood. For people living with sickle cell, right now, the right blood match will be saving a life. So I think I was listening to a podcast recently, and they were mentioning how one person, donating blood can save, so many lives. So yeah, if you're able to donate, please do scan the QR code. There's still time for you to make a difference in our society. So for the Black Health Legacy Research, we are inviting you to please take part in a short online survey as part of the Black Health Legacy project that CAN is taking up. And it will only take you about 15 to 20 minutes, and it helps with health research. Helps to make health research fairer for the Black community. So your voice really does matter in shaping the future of research. It's important that research is done for you, not on you. And finally, just to close again, just to say very big thank you to Dr. Joan and Dr. Kamara for your leadership and your support. And I just want to thank everyone for joining us today and staying engaged. And we hope to see you next week. Thank you very much.
Okay. Brilliant. Thank you.
Thank you.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.